Today's workout is meant to help you overcome mild low back pain.
I broke my back.
Or if you don't have any low back pain, like over 80% of people in the United States are going to experience, my back, to help you ward it off so that it never becomes a problem for you in the first place. I'm Dr. Pastuch, and I've been giving workouts like this to my clients and patients since 2014. It's all based on stuff that works. None of this is theoretical, so let's dive right into it. Just about any piece of scientific literature you're going to find is going to show you that exercise is beneficial for reducing aches and pains. Now, I understand you might be concerned too much exercise can make it worse, too heavy can make it worse. Both of those things are certainly true, so can bad technique, so can overtraining, all of those things. That's why the workout that I'm designing for you today is lightweight. It's meant to be done with nasal breathing, which is going to modulate the amount of intensity you're able to do it with. It's going to keep it low. And all of the movements that we're doing are fairly gentle with limited ranges of motion that you have complete control over increasing or decreasing depending on how you feel. Today's workout requires one piece of equipment. It's the kettlebell. I would recommend using a light one. The one I have here in my hands is 25 pounds, and that's gonna be enough weight. It might even be a challenging amount of weight for me to do this workout, and I have extensive experience using kettlebells for the better part of 2 decades. So if you're lacking confidence with a kettlebell, go a little bit lighter and work your way up. The workout is meant to be done 15 minutes for quality with nasal breathing only. Do not breathe through your mouth. It means you're going too hard. Slow it down. 10 kettlebell swings on the left, 10 kettlebell swings on the right. Follow that up with a kettlebell drag. I'm going to show you what that looks like. Then we're going to do 10 kettlebell goblet squats, followed by 10 lateral bends to the left and lateral bends to the right. And we're going to finish the whole thing up with 10 steps reciprocal walking with the kettlebell. Again, I'll show you what that looks like in a moment. For the kettlebell swing, we're just going to give a slight lean forward, and we're going to finish about chest height. We're not looking to go overhead, and we are looking to come higher up than our waist. 10 reps on the left, and then 10 reps on the right. You can put it down in between, or you can switch hands in the middle if you feel like you have the ability to do it. The kettlebell drag is exactly what it sounds like. We're going to put the kettlebell down on the ground where we were, spread out our feet nice and wide so that we start to feel a slight stretch in our groin. Shoot your hips back, grab the kettlebell, and just pull it into where you are. Back up, and do it again. You're going to repeat that for 10 reps. So as we back up and widen our stance, we should feel a little stretch in through here. What that means is that these muscles are on tension towards the end of their range of motion. We're going to then shoot the hips straight back until we feel that same stretch in the middle of the hamstrings. From here, it shouldn't be right in front of us. We should have to reach, really put some strain on the hamstrings. You'll feel that tension start to build, and then we're going to just stand ourselves straight up as we bring the kettlebell in. Oftentimes, low back pain can come from dysfunctional hamstrings or any kind of sequencing issue between the way that we use our hips, our low back, and our upper extremity. This is an exercise that forces us to brace in order to maintain the positions and move through ranges of motion that otherwise could become injurious if we experience them for the first time without having trained them. Up next is 10 goblet squats. Grab your kettlebell and hold it comfortably like you're sipping a cup of wine. And then all we're going to do from here is squat straight down, hold for 1 second, and stand back up. We're going to do 10 reps of these. You want to go as deep as your hips will allow you to go without looking like a dog taking a poop at the bottom. So as you lower yourself down, if you're feeling tightness or stiffness in your hips, your low back, or your knees, it's not that I want you to ignore it, but what I do want you to do, getting heavy to hold that, what I do want you to do is pay attention and ask yourself, does this feel like something that is problematic, or does it feel like something that I need? If it feels like it's something that you need, then relax yourself into it. If it feels like it's something that's problematic, restrict that range of motion a little bit. The next exercise is lateral bends, holding the weight in one hand. So we're going to lean as far to the side with the weight as we possibly can. Sometimes I find that it helps to bring the opposite arm up and put it on the side of the head and just lean, 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 lean. And when we get to the bottom, we're going to stand back up. All the way down, all the way up. Resist the urgency that you're going to feel to start to rotate and bend forward. We don't want to bend forward. We just want to bend straight to the side. It's a smaller range of motion, and that's by design. Your doctor might have told you to be careful doing things like lateral bending or flexing or rotating with a weight like I'm teaching you to do in this video. But what's important for you to understand and for you to bring back to your doctor as a question next time if this is a concern for you, or even before you do this workout, if you want to have 100% certainty that your doctor gives you clearance. If that's important to you, make the call first. How are you supposed to avoid these things in real life? You're going to find yourself leaning to the side. How are you going to scratch your leg? How are you going to pick something off of the floor? How are you going to walk? All of these things are happening in regular time in real life. And I believe it's in your best interests to build strength and durability and resiliency to these movements in a controlled environment instead of avoiding them out of fear that they're not going to be good for you and that they actually might cause you harm. You're in the driver's seat though. So if you want to call your doctor and ask first, ask your doctor, how am I going to avoid doing these things in the real world? And if I can't, how am I going to keep myself safe when I have to? The last movement in this workout is called the reciprocal walk. We're going to take 20 total steps. And with each step, we're going to bring the kettlebell all the way to the outside of the hip on the side that's forward. So as I step with my right, I bring the kettlebell to my right. As I step with my left, I bring it to my left. What's important is that you're not doing it slowly and broken like I just did. It's walking. Boom, boom, boom. Rotating as we walk. This is a great way to simulate stuff like running, because as we take a step forward with the right, when we run, all of our momentum would be going to the right with our upper body in running. When we do it with a weight like this, it gives us the ability to simulate the kind of intensity that we rotate into the forward leg with when we're using it out in space, and it makes stuff like walking much easier for people who are already struggling to walk, especially if they get low back pain when they do it. It's a great way to load the movement without having to really load the structures at the kind of intensity that would be required to load them by themselves if you weren't incorporating it in something like this. So that's the workout. It's very straightforward, it's simple, and it's fairly low skill. The reason why I like to do workouts like this on a regular basis, at least once a week, is because it gives us the ability to, one, get our head into our workout instead of out of our workout. Oftentimes we're just lifting as heavy as we can, moving as fast as we can, and not really learning anything as we do it, except that we're getting better at what we already were pretty good at. Workouts like this force us to stay mentally in them. I think of them kind of like meditation. They're a way to stay present in the workout, to touch on end ranges of joints that are otherwise the areas where injury is going to happen because we avoid them. And it teaches us how to do things for quality instead of just for quantity or for maximum speed. And I think that that's an art that's being lost far too much because we're optimizing for the best of everything, except the way that we do it. And so I think that this is a great way to slow down, improve your neurological and your muscular recovery, and learn how to think while you're exercising instead of using exercise so you don't have to think. If you're concerned about whether this is dangerous for you or not, I'll give you some red flags to watch out for. If from rep to rep of any exercise, things are getting worse, more and more and more uncomfortable, don't do it. Put something else in place where that doesn't happen. If you're experiencing sharp pain or tingles or any kind of numbness down your arms or legs, don't do it. It's not worth it. And of course, if you're feeling acute, sharp, like one little spot, like, ooh, it hurts right there, really sharp every time I do this, give yourself a scale of 1 to 10. If it's higher than a 4, I want you to back off. I don't need you to be pushing through pain to do this. I do want you to push through some discomfort, but I don't want you to push through serious pain. As far as green flags, take the opposite of all of those things. If those things are absent, the voice in your mind is probably what's telling you to stop more than your body. And you need to ask yourself more often, probably, should I be listening to that voice or does it have bad information? Have fun with this workout, and if there are other joints in your body besides your low back that are problematic for you, comment below and we'll make some videos about them. If you like this video, remember, hit the like button, subscribe to the channel, leave us a comment, and I'm Dr. Pastuch. This video is over.